Okay, hi. So this is the Introduction to Medical Terminology lecture for Chapter 7 for juniors medical assistant class. So medical terminology is the language of medicine. And it's just like learning any other new language. There's a lot of pieces and a lot of parts, a lot of components that go into it. And we're going to talk about those components, the rules, and how to make them words when you only have pieces. So there are four types of word parts. They are used to create all different kinds of medical terms. They are word roots, combining forms, suffixes, and prefixes. We call them word parts as a whole, but each one is something specific. So a prefix is at the beginning of the word. A root is kind of like your middle ground. It's your roots, like the roots of a tree. And we're going to talk about each one of these at length in the next slides. And then the suffix is your tail end. Like I said, we'll talk about each one. And then a combining form is something else we'll talk about. So hang in there. Word roots contain the basic meaning of the term. These tell you what body part you're working with. For instance, the word root gaster means stomach. Gaster is spelled Gastr hyphen. That's how we identify the stomach in medical terminology. These cannot stand by themselves. They can't just be independent. They have to have a suffix attached to them. Combining forms, as mentioned before, is a word root, like we just talked about, so gaster, with a combining vowel at the end. The combining vowel for gaster would be O. So it would be written Gastr slash backslash O. That's how you create a combining form. It is used when two word roots are combined or when a suffix beginning with a consonant is added. A consonant is any letter in the alphabet other than a vowel. Your vowels are A, E, I, O, U, and sometimes Y. When word roots appear alone, the combining form is shown with a backslash between the word root and the combining vowel. You always want to follow this rule. The rule of adding a vowel applies when a suffix begins with a consonant and it's being added to a word root. So for instance, if you try to put gaster with paresis, that's a suffix, you would have to add the O. So it would be gastroparesis as opposed to gastroparesis. The reason we use combining forms is because it makes the pronunciation of the term smoother, so that it's more logical and easier to say. That's the purpose of the combining form. I will be posting another video here shortly this morning to let you see. I'm gonna do a handwriting video, and you'll be able to see exactly what I'm talking about with the word roots. So the word root again is the basic meaning of the term. It's usually the body part that's being worked on or is involved in whatever you're trying to talk about. It cannot stand alone. It usually often I should say, has a combining form, which is a vowel that's added to the end so that it can be connected to a suffix that starts with a consonant so that the word is easier to pronounce. Suffixes are usually, but not always, indicative of what the procedure, condition, disorder, or disease is. So for instance, the term ectomy, so if you're doing a gastrectomy, that's a surgical removal of the stomach. It always comes at the end of the word, and it has a hyphen in the front of it. Excuse me. So remember, if it's a suffix, there's a hyphen at the beginning of it, not at the end. It always comes at the end of the word, and it indicates what's being done, what's wrong, or what disease is affecting the body part. Prefixes are usually, but not always, indicative of the location, the time, the number, or the status. I like to use the indication or the example of pre and post. Pre means before, post means after. So this would indicate the time, for instance. It always comes at the beginning of the word, and a hyphen always comes at the end of the word if it's a prefix. But be aware, a lot of words don't have prefixes. Their word root is sufficient, but they always have to have a word root and a suffix. Word roots and combining forms that indicate color. There are several. They're actually pretty interesting. I have them labeled in the color in which they are technically considered. So cyano is a combining form that indicates blue. An example would be cyanosis, the term listed above, blue discoloration of the skin caused by a lack of adequate oxygen in the blood. Cyanosis. Osis by itself means condition or any condition. Cyan means blue. So if you put them together, it's a condition of being blue, or in medical terms, blue discoloration of the skin caused by a lack of adequate oxygen in the blood. I like to use the reference of when you're really, really cold or your circulation isn't very good, your lips can turn blue. That's cyanosis. The next term we're going to talk about is erythro. Erythro is red. Cyte means cell. So if you look at the form in the next line, erythrocyte is a mature red blood cell. Cyte means cell, erythro means red. So it literally transfers to a red cell. The next one is leuco, which equals white. Leukocyte, cyte means cell, leuco means white. It's a white blood cell. Melano equals black. Melanosis is any condition of unusual deposits of black pigment in body tissues or organs. Melanosis. Osis means condition. Melano or melon means black. So therefore it is a condition of unusual deposits of black pigment in body tissues or organs. Polio equals gray. Polio is the term that means gray, but it is also a disease. So poliomyelitis is a viral infection of the gray nerve tissue of the spinal cord. Myel means spinal cord and itis means inflammation. So this term is actually a little bit more involved than what we've done so far. Polio is going to be your word root, but there's another word root, which is myel, M-Y-E-L. And then itis is your suffix. So there are 3 word parts to create that term as a whole. So cyano means blue, erythro means red, leuco means white, melano means black, and polio means gray. Combining form vowels. Okay, so here's where the rules get interesting. So a combining form includes a vowel, usually the letter O, added to the end of the word root. It is usually added to make the resulting medical term easier to pronounce, as I had mentioned in the slide before. When 2 word roots are joined together, a combining vowel is always added to the first word root. Just to give you an example, I'm going to go back. Poliomyelitis. You have 2 word roots here. Polio and then myel, and then your suffix is itis. So you have to include the the O at the end of poly to make sure that you can conjoin those 2 word roots. So when 2 word roots are joined, a combining vowel is added to the first word root. A combining vowel is used at the end of the second word root only if the suffix begins with a consonant. So going back, the term poliomyelitis, if you look here, these 2 word roots here, you have your combining vowel, but itis begins with I, which is a vowel, so you don't need to add another vowel to combine those. Another example would be gastroenteritis. Now, this is combining 2 word roots with a suffix. Gaster is joined with enter. A vowel is used to make the combining form gastro. So even though enter begins with E, which is a vowel, you still have to add the O, because anytime you're combining 2 word roots, you have to add that combining vowel. The word root enter is joined to itis without a combining vowel because the suffix begins with a vowel. So therefore, gastroenteritis is an inflammation of the stomach and small intestines. As you're watching this video, I encourage you to say these terms out loud and get familiar with the pronunciations, because those will be really important as time moves into different body systems and different chapters. So suffixes are always added at the end of the word to complete that term. In medical terminology, they usually, but do not always, indicate a procedure, condition, disorder, or disease. We've talked about that a little bit. We're going to talk about it a little bit more. A combining vowel is used when the suffix begins with a consonant. Remember, a consonant is any letter in the alphabet other than a vowel. So an example, Neuro, N-E-U-R \O, is joined with the suffix plasty or raffy. The combining vowel O is used because plasty and raffy both begin with consonants. A combining vowel is not used when the suffix begins with a vowel. So another example, tonsil, T-O-N-S-I-L-L. You don't need a combining vowel when you're adding either itis or ectomy to tonsil because they both start with a vowel. These suffixes complete the term and tell us what happened to the tonsils. Basically, when you're building medical terms, you're kind of telling us a story. You're telling us what happened, where it happened, and when or how it happened, which is pretty interesting. Suffixes as noun endings. So this is where it can get a little messy. A noun is a word that is the name of a person, a place, or a thing. In medical terminology, some suffixes change the word root into a noun. So example, the cranium is the portion of the skull that encloses the brain. Crani means skull, and is a noun ending. You'll always see that the noun endings make sense in terms of pronunciation. So if you were to put cranius, that's not as smooth of a word as cranium. So when you're referring to the skull in terms of the area that encloses the brain, you would call it the cranium. That is a name of a person, place, or thing. Therefore, it is a noun. The makes it, right here, this makes it a noun. Suffixes that mean pertaining to. I encourage you to document or to write these down on flashcards, note cards, in your notebooks, however you need to, because you're going to want to be familiar with what these mean. There are multiple suffixes that mean pertaining to, and they are used often. An adjective is a word that defines or describes. In medical terminology, many suffixes meaning pertaining to are used to change the meaning of a word into an adjective. This example would be, now I'm trying to think. If you use gastric, gaster, and then ick is right here, I-C, and gaster, G-A-S-T-R hyphen, and then you add hyphen I-C, it becomes gastric. It then means pertaining to the stomach. Therefore, it becomes an adjective. Suffixes that mean abnormal condition. Again, you need to write these down. These are very valuable to understand, and you do need to know what they mean. There are multiple that mean abnormal condition. Ago, esis, ia, iasis, ion, ism, and osis. If you recall several slides back, we talked about osis meaning condition or abnormal condition. I'm sorry, any condition or abnormal condition. These also mean the same thing. So you will see all of these be used in that context, so be aware of what they mean. Now let's talk about suffixes that are related to pathology. First, we need to know what pathology is. Let's break the word apart. So, pathology. So path means disease, and ology means the study of. So we're talking about the study of diseases, and it's technically defined as pathology is the study of all aspects of disease. Suffixes related to pathology describe specific disease conditions. Algia, dynia, itis, megaly, malacia, necrosis, sclerosis, and stenosis. Algia means pain. Dynia means pain. Itis means inflammation. Megaly means enlarged. Malacia means softening. Necrosis means death. Sclerosis means hardening. And stenosis means narrowing. So as you see here, these are suffixes that are related to pathology. Suffixes that are related to procedures. Some suffixes identify the procedure that is performed on the body part indicated by the word root. Synthesis is the process of puncturing to remove fluid. Graphy and gram both mean to record. Plasty is the surgical repair. Oh, sorry. I went too far. And scopy means to look or observe. Okay? The double R's, these are interesting and they get confusing as you move through Dean Vaughan in part of your assignment. You'll notice that they leave a lot of the extra R off, but these are actually double R's, and the extra R is important. So medical terminology suffixes beginning with two of the letter R, often referred to as the double R's, can be particularly confusing. These word parts are of Greek origin. They are grouped together here to help you understand them and remember their differences. So there's Raj, Raphi, Rhea, and Rhexis. These all have their own meaning, and I encourage you to research these so that you can use them properly. I believe Raj is to break. Oh, no, I'm sorry. Raj is, I can never remember that one. Okay, hold on, we'll move on. So Raphi is to suture. Rhea is to flow. Rhexis is to break or burst. Oops, sorry. And I can never remember Raj, so I apologize for that. To break or burst. I encourage you to look this one up because I cannot, my mind is blank and I cannot remember what it means. Prefix is something, okay, so we're going to talk about prefixes. So a prefix is sometimes added to the beginning of the word to influence the meaning of that term. Prefixes usually, but do not always, indicate a location, a time, or a number. So these are interesting. Ab. Ab means away from. The best way to remember this is if you're abducting something, you're taking it away. Ab equals away. Add, A-D, not A-D-D. A-D means putting it toward or in the direction of. This is a reference to you're adding it back to where it came from. So ab is abduct or away from. Add is add to or toward. Dextro, D-E-X-T-R-O, equals your right side. Sinistro equals your left side. This is usually in reference to eyes and ears. So pay attention to that when we get into general patient care and we're doing vital signs and we're doing Snellen charts for eye acuity. You'll notice we use these terms a lot. X equals outside of, outside, out of, outside, or away from. In is in, into, not, or without. This one can get messy. You need to really be familiar with how this is being used in the medical term. Macro means large, abnormal size, or long, and micro means small. Mega or mega means large or great. Olig means scanty or few. Pre is before and post is after or behind. It can be used both ways. So let's talk about contrasting and confusing prefixes. Some prefixes are confusing because they are similar in spelling but opposite in meaning. Again, ab and ad. Ab means away from. Abnormal means not normal or away from normal. Ad means toward or in the direction of. Addiction means being drawn toward or having a strong dependence on a drug or substance. Dis means bad, difficult, or painful. Dysfunctional means an organ or body part that is not working properly. Eu or EU means good, normal, well, or easy. Eupnea means easy or normal breathing. Hyper means excessive or increased. Hypertension is higher than normal blood pressure. Hypo means deficient or decreased. Hypotension is lower than normal blood pressure. These two, the next two, are very confusing. So please make sure you're writing these down and understanding them. Inter means between or among. Interstitial means between, but not within the parts of a tissue. Intra means within or inside. Intramuscular means within the muscle. Inter means between. Intra means inside. It's really important that we understand the difference between those and we use those properly in medical terminology. Sub means under, less, or below. Super or supra means above or excessive. So you can see they're very similar, but they mean very different things, or contrasting things rather. So determining the meanings on the basis of word parts. So knowing the meaning of word parts makes it possible to understand what the definition of an unfamiliar medical term is. And I say this in class a lot, and I want to make sure that you understand this. If you can break the word apart, you can do anything in medical terminology. If you can identify the word roots, the suffixes and the prefixes, and any of the word terminals that are like ick, ack, tick, all that stuff, you can figure out any medical term. So to determine a word's meaning by looking at the component pieces, you must first separate it into word parts. Always start at the end of the word with the suffix and work towards the beginning. We start at the back and then we go to the front. As you separate the word parts, identify the meaning of each. Identifying the meaning of each part should give you a definition of the term. Because some word parts have more than one meaning, it is so necessary to determine the context in which the term is being used. As used here, context means to determine which body system the term is referring to. If you have any doubt, use your medical dictionary or a reliable source online to double check your definition, but make sure that you're using the terms or that you're using medical terminology sites and not just Googling it, because if you Google it, you might get the English definition of a term when in reality you're seeking a medical terminology definition. But be aware that not all medical terms are made up of word parts. So it can definitely be confusing. So we're going to take a word apart, and I posted a video on Classroom already of doing this, but let's do it again together. So otorhinolaryngology. So we have, looking at the word parts, we have oto, which means ear, rhino, which means nose, larynx, oops, I missed my L, larynx, which means throat, and then ology, which means the study of. So made up of two combining forms, a word root and a suffix. This is how it looks when the word parts have been separated by working from the end to the beginning. So remember, we start at the end, the suffix. The suffix ology means the study of. Then we go back to the beginning, okay? We technically can start here since these are all word roots and there's no prefixes. So it would be the word root larynx means larynx or throat. The combining vowel is not used here because the word root is joining a suffix that begins with a vowel. The combining form rhino means nose. Now see, we combined two word roots, so we had to use our combining vowel here, okay? And then the word root oto comes with its own O. So oto means ear, and we use that O to combine the two there as well. So it means the study of the ears, nose, and throat, okay? Singular and plural endings. Many medical terms have Greek or Latin origins. As a result, these different origins, there are unusual risks or rules for changing a singular word into a plural form. This is something that I think is very valuable to understand, and you really, really, really need to pay attention because changing these from plurals to singulars and vice versa can be very challenging. So here's your guideline. If the singular term ends in the suffix a, the plural is usually formed by changing the end to A-E. To give you examples, the singular version of bursa becomes bursae in plural form. The singular version of vertebra becomes vertebrae in plural form. If the singular term ends in the suffix ex or ix, the plural is usually formed by changing these endings to ICES. Appendix, appendices. Index, indices. Does that make sense, hopefully? If the singular form ends in the suffix is, the plural is usually formed by changing the end to es. Diagnosis, metastasis, diagnoses, metastases. If the singular term ends in the suffix itis, the plural is usually formed by changing the is ending to ides. Arthritis, arthrotides. Meningitis, meningitides. If the singular term ends in the suffix nx, the plural is usually formed by changing the x ending to ges. Phalanx, phalanges. Menex, meninges. If the singular term ends in the suffix on, the plural is usually formed by changing the ending to a. Criterion becomes criteria. Ganglion becomes ganglia. If the term ends in the suffix the plural usually is formed by changing the end to an a. Diverticulum is singular, diverticula is plural. Ovum is singular, ova is plural. If the singular term ends in the suffix us, the plural is usually formed by changing the ending to I. Alveolus is singular, alveoli is plural. Malleolus is singular, malleoli is plural. Again, I would copy these rules down, but please remember that when you're working on your coursework for these chapters, this resource is still on Classroom, so if you ever have questions or need to reference it, it's there for your use. So these are basic medical terms that describe diseases and conditions. A sign is an objective evidence of disease, such as a fever. Objective means the sign can be evaluated or measured by the patient or other. We talk about these at length when we get into general patient care, but it's good to be aware of them now. A symptom is a subjective evidence of a disease, such as pain or a headache. Subjective means that it can be evaluated or measured only by the patient. We can't see their pain. That's a subjective symptom. We can see that they have a fever by taking their temperature. That's objective. So a sign is objective and a symptom is subjective. You need to know the difference. A syndrome is a set of signs and symptoms that occur together as part of a specific disease process. A diagnosis is the identification of a disease. Fun fact, and you should already know this, medical assistants cannot diagnose. We are not physicians. They are the only ones that can diagnose patients. To diagnose is the process of reaching a diagnosis. A differential diagnosis, also known as a rule out, is an attempt to determine which one of several possible diagnoses is causing the signs and symptoms that are present. A prognosis is a prediction of the probable course and outcome of the disease. Acute. An acute condition has a rapid onset, a severe course, and is a relatively short duration. Chronic is a condition of long duration, although such diseases can be controlled. Remission is a temporary or partial or complete disappearance of symptoms of a disease without having achieved a cure. And then a disease is a condition in which one or more body parts are not functioning normally. Some diseases are named for their signs and symptoms. And then there's an eponym. An eponym is a disease structure, operation, or procedure named for the person who discovered it. And then an acronym is a word formed from its initial letter of the major parts of a compound term. I hope this helps. If you have questions, you know how to reach me. I hope you have a great day. See you soon.